My name is Dave Rhew. I'm the Chief Medical Officer for Samsung, and I would like to welcome you to the Samsung Developer Conference. Thank you for attending this session. This is the Smart Health opening session, and for the next 10 minutes, I'll give a quick recap of what you heard earlier today regarding Samsung's direction in healthcare. I'll talk a bit about some of the things that we can look forward to as part of this session. It's a two-day session, all day today, and then most of the day tomorrow. And then highlight a couple of presentations that I think would be worthwhile for you to check out. These are from some of our key guests and strategic partners. So with that said, let me talk a little more about what we are looking to accomplish in the area of healthcare. We have a vision, and that vision at Samsung is that consumers and patients can be empowered to take control of their lives through data and other tools to basically improve the quality of the outcomes. And we think that the platform that we can develop through the use of sensors and really the fine work that all of you will be putting together will enable this to happen. And as part of that, we see what we'll call pillars, different areas within healthcare that will allow us to be able to better understand where we can focus our attention. So those pillars are things that probably you're very familiar with, and maybe one you may not be as familiar with. So let me go through them very quickly. First, mobile. Of course, we know Samsung is very strong in our mobile technologies. These are the devices, whether they be phone, tablet, wearables, and even some of the newer things that you can wear on the headset, Gear VR, et cetera. The sensors and the devices behind that, these are the things that allow us to be able to capture the data, the physiologic data, and other perhaps even non-clinical data that can be used for healthcare purposes. Behind that, there's a logic, a certain sense of algorithms that need to be developed, and of course, it needs to be stored in a secure, HIPAA-compliant manner through a cloud, as well as using big data analytics to be able to process a lot of this. So you're probably familiar with these first four, but the last one is an area that we think is also very important, and we encourage you to think very actively in this area, and it's an area around behavioral science. So what do I mean by behavioral science? I'm talking about not just capturing data and presenting it back to consumers and patients, but better understanding why do some individuals respond well to data and others basically ignore it. How can we get people more engaged? Are there strategies that allow us to be able to motivate, nudge them into certain behaviors and keep them motivated? What makes certain technologies more addictive? Why can we find that certain individuals respond better to certain approaches and others don't? If we can better understand these, apply these to our thinking and how we develop the solutions, we can better engage our patients using the technologies more effectively and efficiently. One of the questions that I am often asked, not just by developers, but by healthcare professionals and other folks in the healthcare industry, is what type of platforms and how does this all fit together? I'm going to give you a quick recap. I think this slide very nicely captures a lot of what you may be familiar with and you heard earlier today, but it puts it into a context of how they work together. So as most of you know, Samsung has the Galaxy. On the Galaxy, there's the S Health application. S Health application allows us to be able to capture data, and this is data that can be related to one's activity, food tracking, and a variety of other elements. We're capturing more and more of this, and it's currently stored in an area where individuals can access it on an S Health platform. And so you'll see that on the slide, the items on the left-hand side being captured from the Samsung devices going into the S Health platform. Most of us are familiar that this is used predominantly by consumers. We are also developing enterprise-wide solutions for this as well. What we heard today is that Samsung is also looking to venture beyond this to other types of devices that one might capture data. These would be third-party, non-Samsung devices, and we're looking to capture that, put it on a reference design, perhaps, which was called SimBand, and ultimately incorporate that into SAMI. The data then gets put into a common data architecture in which the S Health and SAMI platforms communicate and allows us to expand the sources of data that we have available to do the big data analytics and all the different things we talked about for the pillars. So that's a real quick recap of what we're looking to do. Today, we've got a full agenda, and then tomorrow we've got an agenda that takes us all the way to 3 p.m. Today's agenda will be more of a high level with a variety of different topics. We've got some great guest speakers. Tomorrow will be much more technical in nature, and you'll find that as part of that you'll learn a bit more about our platform, our SDKs, SAMI, and SymBand. As you also know that we have demo booths. The demo booths are located right adjacent to the elevators. So this, I guess the graph or the picture on the right-hand side, that little grid in the middle is the elevators. There's a couple of areas that are highlighted, one of which is the voice of the body, which is on the, I guess it's the south side of the elevators. And then on the upper part where all the solutions are, the healthcare-specific solutions are located in the part that's closest to the elevators. These are things that address the services and the platforms, such as our S-Health, the applications that apply for the S-Health, the personal trainer, connected fitness, the server APIs, and our B2B business scenarios. We also have a whole series of building blocks, what we call, these are the chip bioprocessors and real-time sensor toolkits. So I encourage you to check out those demo booths. They're for your benefit, and hopefully you'll learn more and potentially be able to be better engaged in some of these initiatives. So at this point, I'd like to highlight a couple of very interesting sessions that I think are healthcare related that would be things that you should definitely look into and check out. Samsung works very closely with many business partners. One of our very close partners is Nuance. Nuance provides excellent voice recognition technology. It powers our Gear 2, and now soon to be our Gear S. And as part of that, they have been developing applications so that use of the Gear and the Gear S and a variety of other wearables allow us to be able to use voice instead of manual data entry. It's a great way for us to be able to make this more seamless. They have a demonstration of some of their fine work in the area of activity tracking, basically saying, talking to your Gear, or your Gear S, I should say, logging some of the activity that you've done, initiating activities around, let's get, I'm going to start a run or a jog. You can do things around logging the food intake. One of the biggest barriers to entry today is individuals don't like to type and find things. Simply put this up to your face and simply say, had a Big Mac, or ate a banana today. And rather than having to do any data entry, it allows you to be seamlessly capturing that information. Reminders, very important. These could be in conjunction with your healthcare provider or independent, reminding you certain times of the day for medications and other types of things. So I encourage you to check this out. This is going to be today. It won't actually be in this room. It'll be in one of the other sessions. I believe it's from 4 to 5. Another very important session, we oftentimes hear about the role of the FDA. We are very pleased and honored to have Mr. Bakul Patel with us today. Mr. Bakul Patel is the FDA's acting director for digital health, and he will deliver a presentation on the FDA's mobile medical apps guidance, the opportunities the developers may face in terms of developing things and going through the FDA process, and really trying to enable us to better understand that the FDA is here to provide guidance and support in this process. So please encourage you to check this out. This will be in this room today between 4 and 5. So the challenge is, this is between 4 and 5. The Nuance one is 4 to 5. I'll leave it to you to figure out how we can balance that. With that said, I'd like to turn over the stage to a colleague, John Kalkman. John Kalkman is the Vice President of Samsung Semiconductor, and he's here to talk more about the redefining the quantified health market. John?
Good morning, everybody. So I'm what stands between you and lunch. So we'll keep it to about 30 minutes. So I'm going to just take a quick little survey before I get started. How many of you are quantifying what you're doing today, or when you sleep or whatever? How many of you actually wear health bands today? Okay, So, wow, that was like better than 50%, more than I thought. But of course, we're at a technology conference, so of course you're going to be wearing health bands. So, quantification of what you do is, it started with smartphones, of course, and some of the wearables that you see out there, but just simple things like tracking walking, tracking your sleep, and as it become more and more advanced. And so what we want to do is talk with you about probably something that's very unique at this conference, which is the semiconductor side of where Samsung is trying to do something very unique to allow companies to really innovate on everything from design to the software to, really just the longevity of how these devices work. And it all starts with a brand new announcement that we're going to show you today. So Samsung, which is interesting, I get asked this question a lot, even just with my family, like, what do you do at Samsung? Samsung is so big, and automatically when I say to people, oh, where do you work? I work at Samsung. They automatically say, oh, I like your phones. And they are great phones, of course. But we work in the logic side. Most people think of Samsung memory, certainly Samsung displays and their televisions, but we also make a lot of logic silicon, meaning processing zeros and ones. And so we make an SoC, Exynos processor, we make power management to support that processor, we make world-leading image sensors, and modems, near-field communication, security, and we're going to add and announce a brand new silicon area today to add to this portfolio of what we do. So our agenda, or my agenda, is really to talk with you about our quantified health trends and how we're seeing things. What are some of the design challenges around that? Talk about this new innovation that we think is the world's first piece of silicon to do this. We'll show you an awesome demonstration of this actually up and running on some of our initial silicon that we have, and then we'll talk with you about how you can get some more information here in this venue over the next couple of days, and certainly after that as well. So lots of different devices. As our chief medical officer here for the company talked about, there's everything from really some of the wearables that you see on the left side here of the screen to some of the more casual things, which are in the middle. So the wearables, I do encourage you to go take a look at the Galaxy Gear S. Actually, I saw it for the first time myself today. Very innovative device, very light, surprisingly light, but probably one of the more leading edge devices I think that's out there in the market. And then of course smartphones. Many of the Samsung smartphones, including the Galaxy Note and the Galaxy S, have integrated ability to check some of your bio, things that are happening in your body through some sensors that are in the back of the phone. So lots of different devices. Samsung is just only part of this device cycle. There's lots of other companies. We don't have the rights to show their devices up here, but you can imagine companies like Fitbit and others that are out there in the marketplace. They're all trying to figure out how does this market work? Where should we be putting our focus and innovation to really make the devices of the future and frankly their business models. So wearables, easing data collection, it really is about how unobtrusive you can make it and the ease of how the data collection actually happens. And so I can't tell you, I look almost weekly now and you see a new startup company, could be software, could be hardware, could be technology that's inside these devices, announcements that are getting made every single week. From smart eyewear that you see here, health watches, apparel. Apparel is an interesting one. I think the very first one I saw was announced about 2 months ago, where they were showing, basically a shirt that you can wear. Got a little piece of technology blob on the side, but it basically can measure your perspiration while you're exercising, your heart rate, these types of things. And so the wearables market is exploding, and I'll show you a chart here in a moment about how big that is, and I actually even think that that's probably wrong, meaning it's going to get a lot bigger depending on how fast and how interesting these wearables get. So specifically, when you think about these wearables, what are the sensors that are in them? You can kind of see the lower part of this: accelerometer, gyroscope, compass, GPS, altimeter. Most people just expect that to be in their smartphones today or smart devices. But as you raise up to kind of the next level, you're starting to see things like heart rate, perspiration, the oxygenation in your blood, bioimpedance to say, hey, how efficient is your body working? How much body fat is in it? There's this watch that I told you about earlier that we'll be showcasing. It actually checks the UV rays. And so that's actually very important depending on where you live in the world. If you live close to the equator, probably checking with the UV protection that's required that day is very important. And just as kind of a little bit of a comical part of this, we put the Star Trek tricorder up at the top. And for those of you who are not Star Trek fans, it's the tricorder that the guy in the red uniform pulls out and says, wow, I can tell what's going on with you and your body right now. You have this going on. Or they look at a rock and they analyze it. Anyways, you can see the idea and the vision that the explosion of different types of sensors is even going to get more diverse. And at the same time, we're going to have to try and figure out how to make data or make information out of what these sensors are giving us. And hopefully we'll show you our attempt at how we're going to do that from a bio perspective. So the value in the data that these sensors will be showing you, it goes across what we think of as these three pillars, which is wellness. So just really, things like weight management, how's your stress, different types of things like sleep quality. Interesting for me is I really didn't start figuring out my good night's sleep from my bad night's sleep until I started tracking this. And, you actually figure out how many calories am I burning while I sleep at night, but also how many times do I wake up, right? The quality of deep sleep versus light sleep. It's actually pretty interesting, and the algorithms are only going to get better on how that is, but it really does help you say, wow, maybe I shouldn't have had that extra glass of wine with dinner. Maybe that's what made me not sleep so well. So you start to think about why you feel the way you do. Sports and fitness. This is an interesting area. For me personally, I'm a marathon runner. I ran about 3 marathons last year. And it's interesting to figure out how your body responds. So as you get later in the marathon, as you're running it, of course you're tracking GPS and you're using that sensor to say how far have I go, but more importantly, how much further do I have to go? But also you start to look at your heart rate just starts to go up and up by the end of the race. I mean, really polished runners, right, that are running around 2-hour marathons. Those guys don't have to worry about it. It's over before guys like me run it. But I'm a sub 4-hour marathon runner. But your heart rate just slowly goes up higher and higher, and you start to figure out over time, wow, if I can just get my heart rate to stay low, I actually feel a lot better by the time I'm done running. So this is an important area. And then, of course, M-Health, which is just your ability to track things like your heart rate, your O2, your impedance within your body. But you can envision where M-Health would allow you to share that with your doctor or your healthcare professional over time versus them just looking at you for 5 minutes in the doctor's office and saying, wow, this is what I know from you from 5 minutes of examination. You could share more data and they could say, wow, I can see your summer didn't go so well, or I can see, ooh, the last 3 weeks you've had some challenges. And so sensors can provide that kind of data across these different pillars. So this is the chart I was telling you about before. So we tried to pull some of our internal data, ABI and Gartner, to look at how we think this quantified health devices area is growing. And of course you've got smartphones, which most of these have different types of sensors already engaged and working right off the bat when you purchase your smartphone. But it's these other ones that are either complementary or standalone to your smartphone that are interesting. And that's where we're seeing this 22% compounded annual growth rate that that we're looking at. And so these are some of the things I talked about before. So heart rate monitors, smart watches, glasses, apparel. And so we think this is going to take off and potentially even be bigger. And so I would actually consider this chart to be pretty conservative based on what we know today. So now I just wanted to tell you a personal story for me. So I also, before I started marathon running, I was a mountain climber. And in particular, I was trying to track and get to the 7 summits. And I got about halfway through that. But this is an interesting one I did about 12, 13 years ago. This is Kilimanjaro, which is in Tanzania, Central Africa. And it's a mountain that's about just under 20,000, like, was it 19,300 and some odd feet tall. And I just remember most people climb Kilimanjaro because they want to do it in conjunction with doing a safari or something like that. But I just remember on other mountain climbs that I did, it was pretty buff men and women. They'd been climbing for a long time. So I climbed Denali up in Alaska. I did Aconcagua down in Argentina. These were really tough glaciated mountains. This one pretty much is, you have a little pack on your back, and the toughest day you have is the last day, which is when you summit. But I just remember we had people that I would say one particular gentleman was over 70 years old. A couple of others had just newly retired. They were in their late 50s. And then there were a couple of young folks. And I was probably just above that, somewhere between the retired and the young folks in their 20s. And you can imagine, right? Different people were going at different rates as they climbed Kilimanjaro. And it wasn't until, really the summit day or the summit morning, because you start climbing the summit of Kilimanjaro at about 12:30, 1 a.m. in the morning, because you want to climb when it's safest. And you do get on the glacier at that time, and then you hit the top. And so it was interesting. We couldn't tell how healthy people were, right? And of course, you look at all these different, folks that you're talking to, and you're like, hey, how are you feeling today? Oh, I'm great, right? But there was no data to really quantify how great are they. And it wasn't until I climbed later, there was this O2 meter that sits on your finger and actually points an infrared light through the cuticle on your finger, and it could tell what your oxygenation was in your body. And unfortunately, 3 of the people that we were climbing with, if we just would have had that device or had some of this new technology that you're seeing today, the lead guide could have said, wow, I can see your O2 rate is, just in the upper 60 percentile, right? Us right now, we're probably somewhere between 98% and higher. But just with that little bit of data, he could have given the folks that were climbing saying, do you think you're going to make this or not make it? He could have given them data saying, wow, look where you are in comparison to everybody else. I think it's going to be unsafe for you to summit with the rest of the team today. And so we had people that turned around halfway up, some people that didn't try at all. But you can see how a real life example like this with some of this sensor technology can really aid in helping mountain climbers of all ages in this particular case. So, health sensing challenges. So, you have sensor wearables, right? You want accurate, stylish, unobtrusive. It just does what it's supposed to do without me even thinking about it. Pretty much like how timepieces are today. They run, sometimes you have to wind them, sometimes they just run forever, right? But you want it to be, in some cases inexpensive, secure with what information it is gathering. And on the other side of this rope is, what are the challenges in actually designing it? You want it to have, great power dynamics. You don't want it to have, where the silicon that's in it defines how you actually design the wearable that you want to have, right? You don't want a bunch of chip count. You don't want a PCB in there that you're laying all these chips on and says, wow, that's the best we can do in the design. You want something that is very small, and you design the device the way you want to, and silicon just fits into a very small part of what that looks like. And so with that, I'll unveil and tell you, this is Samsung's Bio-Processor. This is something that we've been working on for several years. It is a single small chip. We'll talk more about what actually is in it in the next slide, but this has actually 3 very unique sensors. It's optimized for low power. We believe it's actually the lowest in the industry, and this is the first of its kind to have fully integrated security so that the data that you have in there, whether you're collecting it locally or transmitting it, it is very secure. So, introducing the Samsung Bio-Processor. Let's take a closer look at actually what's in the device here. So, first of all, this is built on Samsung's very tried and true 45 nanometer fab process. So we think that this is, most of the others are in the 100 or 90 nanometer at most type design. It's got data encryption, as I said, with security. Ultra low power, we've actually included a DSP in here, so you can actually shut almost everything off except the sensors and the DSP, and it can run at a very, very low power envelope. There is an MCU in here for doing some of the processing, and so the 3 sensors that we have are an electrocardiogram, a PPG, or photoplethysmogram, and a bioelectric impedance sensor. And so you can see to the right, or your right side, you can see the different types of waveform data that you can collect. And your health metrics that you can collect in just this single piece of silicon is, what is my body fat, my respiration, this is what I was talking about for the Kilimanjaro point, which is, hey, what's my respiration, how oxygenated is my blood, my heart rate, and then of course your blood pressure. And so all of this is in a very, very tiny solution. So you can see here exactly the size. So we actually did a little bit of research, and we went out on the internet. Actually, Brent, my colleague, who I'll introduce here in a moment, went up and we said, what is the best we can find of all of the silicon that's out there? And if you look at just the chip design that you're seeing here of discrete components, we believe that that takes up just over 400 millimeters squared of size. With this solution that we have, if you take that same silicon and stick it in, but we also, of course, as I told you, have security and other parts that are in there as well that are not shown on here, we're 95% smaller at 22 millimeters squared. So if you look at that and you look at the relative size, that watch is, to the right of it is supposed to show what that relative size would be. So think about how you could dynamically design a better device or a better solution based on this Samsung Bio-Processor. So it's our best integrated monolithic solution for collecting bioinformation. One of the unique things also outside of size that we think is interesting on this is how we've designed the power envelope that this works in. And so we have analog front ends that we believe or certainly do work at a 1.1 volt range, whereas we think most of the rest of the industry is somewhere in the 3 volt range. So right there, we believe we're saving about 50%. From an overall system perspective, meaning the actual bioprocessor itself, we employ also some patented areas around how we do clock and power gating. We also do dynamic frequency and voltage scaling as well, and that's pretty standard stuff. But how you do this on a bioprocessor, we've got what I like to call some secret sauce in how we do this. But we do believe that this is probably one of the most power efficient platforms that's out there in the industry today. So how versatile is this platform? This can be worked in 2 different solutions. You can either have it work in conjunction with an application processor, and it becomes basically your co-processor for the bioinformation that's coming in. You can also bring in some of the other digital sensors that we talked about earlier, like your accelerometer, gyroscope, temperature, etc. You also can use this as a standalone, meaning you don't need an SoC if you really just want a simple device, like a medical device that you would wear, and which we're actually going to demonstrate to you here in just a few moments. You can use this as a standalone device because it does have an M4 processor, as I showed you earlier. So, you know, what do you get? So we're going to offer up some actually fully engaged development tools. So you actually can get an evaluation module with our very early evaluation silicon on it. And this will come with a full software suite so that you can actually connect in with these analog front ends and basically create the device that you want. Full software tools, compilers, debuggers, documentation, etc. So our goal is, hey, you can start working on this, you know, probably within the next couple of weeks and start building the device that you want with this new bioprocessor. So now what I'd like to do is invite up Brent Kirby. He's our director in our silicon group here in Samsung, and he's going to demonstrate our S-patch using this silicon.
Hello, hello. Can you guys hear me? So the first part of my demonstration here is, one, you're going to notice that I am alive, and two, you can monitor how nervous I am in real time. So what we're going to show you here today is what is called our S-patch, and it's a mHealth type device that allows you to monitor your ECG. And if we can jump to the video here, right there is proof that I am not heartless and that I am alive, and my heart rate when I was sitting there was 74, and I'm going to try to bring this down here as I calm down a little bit. So right now what I'm actually wearing a device that is very similar to this. It's using our first piece of silicon. This is actually just an ECG, using the ECG portion of our chip. What's very cool about this, what John talked about, is the form factor is very small, especially in the fact that it has 3 different sensors. Again, this is just ECG. But you can see this little teeny device here, and if you want to come see me after the presentation, this top half that's, you know, barely the size of a quarter is what's basically capturing all this data. This bottom half is actually a battery. So what we're doing right now is I'm basically connected to the strap right now on my body, and through Bluetooth, I'm going to get in trouble. The engineer's going to yell at me. I'm getting too far away because this is using a BLE type technology. But it's basically transferring the data real time to this device. This particular device, we are doing a case study with a hospital right now. And what's really cool about this device, John alluded to the power management that it had built in it. This device can constantly monitor your ECG for up to 7 days. So the hospitals seem to be very excited about this. One, because of the form factor. I forget I even have the thing on. It's very small, and you want to make sure it's not cumbersome or obtrusive, if you will. But anyway, the other thing I want to point out here that's very, very, very important is that I'm only 21 years old. And my BMI is very good. So I need someone to take a picture of this so I can send it to my wife so she'll get off my case. So anyway, now that concludes my, my demo. If you want to come see this thing in person after John's done presenting, come see me, and I'll let you guys handle this thing and check it out. Thank you.
Thanks, Brent. Brent is the oldest looking 21-year-old I know.
Hey, hey.
So, you know, just what he showed here. So super slim form factor, simplified design. One side of it's the battery, one side of it's actually the sensors and what it has. But what he didn't show is, here's the other pieces of silicon. This is all you need, right? Our bioprocessor, right? The Bluetooth module that you see there, and a little bit of flash. And the reason you need the flash in there is, as Brent talked about, you know, you don't want to be firing up all of this all the time, right? You want to only hit the bioprocessor when you need to, or sorry, fire up the Bluetooth when you need to. So you can envision that, hey, just the DSP is running, collecting the data, caching it into your flash, and then when you need to transmit and put that up somewhere to store it, right, in a secure way using our security elements that are in there, this is what's going to save you the power. And you could wear this, you know, continuously, you can imagine in the future, for a long, long time. So very efficient design, very smart and diverse way of how you could actually apply this. So what is our roadmap? So we're making the evaluation kits. They're ready, within the next couple of weeks, depending on what type of designer you are, whether it be software, device, or something else. Our goal is to get this out by the middle of next year in final form for devices as early as the second half or perhaps the first half of 2016. You can see, though, also, we're not stopping. We're always evaluating, hey, what other types of sensor analog front ends could we be putting in this? What other types of ways could we be re-orchestrating how we've done this bioprocessor? And as I mentioned before, there's a lot of sensors that are out there. And so our goal is going to be, hey, how can we make the most full-featured and usable bioprocessor that's out there in the market that combines everything you would need for a wearable device? This just shows you, that's a finger, by the way. That just shows you in reality how big this bioprocessor is. So very, very small. So again, 95% smaller than all the discrete components that we see out there today, 50% less power, and really the versatility to use in a device like Brent showed you, or a full-featured, perhaps wearable watch, smartphone, etc. Any type of design that you would feel comfortable developing. So we believe it's the first in the market to show and do all of these features, and also likely from an economic perspective will be the most cost efficient for you in your designs. So what do you want to do to learn more? So certainly if you actually walk out this door and go to your left, instead of going down the escalators, just look to the left. That's our booth, right? And that's where we've got our experience zone. We've got really well-trained engineers that are there. They can talk you through the different applications for what this is, actually show you some of the software up and running, and actually give you an extended demo of how this works. But also, another colleague of mine, Rahman, will be here in this very same room tomorrow at 9 a.m., and he's going to go through the technical depth of our new bioprocessor. If you have any questions, my name is John Kalkman, john.kalkman@samsung.com. If you've got follow-up questions, we also have a more generic location at bp.sec. BP stands for bioprocessor, and you can send email to there as well. But either one will work, and we'll get you the information you need to know about our brand new world's first bioprocessor. So with that, I will say thank you, and we look forward to working with you on bioprocessor designs.